Welcome to the Explainer. Today we're going to break down something super common and, let's be honest, really annoying: swimmer's ear.
All right, let's start with this. Have you ever had a great day at the pool or the beach only to have one of your ears start feeling just off later on? It's painful, maybe a little itchy, and everything sounds kind of muffled. If that sounds familiar, well, you are definitely in the right place.
Yeah, that feeling, it actually has a proper medical name: Otitis externa. But you and we know it as swimmer's ear. So in this Explainer, we're going to dive right in to what it is, why it happens, and the big one: what you can actually do about it.
Okay, so what is a swimmer's ear? I mean, what's really happening in there? It's like your ear canal is the perfect storm for an infection. So here's the official definition: otitis externa. It's basically an inflammation of the external auditory canal. That's the little tunnel that runs from your outer ear all the way to your eardrum. And yeah, it's usually caused by an infection.
And this is the perfect way to think about it. Imagine your ear canal is like a cave. It's warm, it's dark, and when water gets in, it gets moist. I mean, that is the absolute perfect breeding ground for bacteria to just throw a party and multiply. All right, we know the conditions are just right for an infection to start. But what are the actual signs you should be looking for? And what are the things that really kick this whole process off?
So what does it feel like? This chart is super interesting. Ear pain, or otalgia, is the #1 complaint by a long shot. A whopping 70% of cases report it. And right behind that, you've got itching at 60%. So if your ear starts hurting after you've been in the water, chances are pretty high that this is what you're dealing with.
And here's the thing: it's not just about the water. While moisture is a huge part of the puzzle, it's often not the only piece. Anything that messes with your ear canal's natural defenses — I'm talking about scratching it, cleaning it too much, not having enough protective earwax — all of that can basically open the door and invite an infection right in. And you don't have to take my word for it. The source material is crystal clear here. It says, trauma to the EAC allows inoculation of organisms. Basically, when we damage that delicate skin with things like our fingernails or, and this is a big one, cotton swabs, we're essentially rolling out the welcome mat for bacteria. And seriously, let's just focus on that for a second, because it is so, so important. We've all done it, right? We think we're cleaning our ears with cotton swabs, but what's really happening is we're often just scraping that delicate protective layer inside the canal and, even worse, pushing gunk further in. This is, without a doubt, one of the most common and totally preventable ways we cause the trauma that leads to swimmer's ear. Okay, so while we call it swimmer's ear, and that's definitely the most common type, it's important to know that's not the whole story. The problem isn't always from swimming, and it can show up in a few different ways. Right, so on one side, you've got the one we've been talking about, acute diffuse, which is that classic bacterial infection from moisture and a little bit of trauma. But then you have these other forms. For example, it could be localized, which is just a fancy way of saying a boil from an infected hair follicle. Or it can even be chronic, meaning it lasts for more than 3 months, and that's often tied to skin conditions like eczema or psoriasis. Okay, so you've got the symptoms: the pain, the itching. How do you treat it? Let's talk about the path to relief. The treatment journey is usually pretty direct, which is great. First, a doctor confirms that's what it is. Then, the main weapon in the arsenal is topical drops. These go right into your ear canal, and they usually have an antibiotic to fight the bacteria, and sometimes a corticosteroid to bring down that awful swelling. And of course, you'll want something for the pain. And here is the really good news: the treatment works pretty fast. I know that pain can feel super intense, but most people start feeling way, way better within just 48 to 72 hours. That's just 2 or 3 days after starting the drops. So relief is definitely on the way. Okay, so treatment is great and all, but you know what's even better? Not getting it in the first place, right? So let's talk prevention. This is how you keep your ear canals healthy and happy. This checklist is basically your new best friend for ear health. The 2 biggest rules: keep them dry and don't mess with them. So after you swim or shower, tilt your head to let the water out.
You can even use a blow dryer on the lowest, coolest setting. Seriously, it works. And I know I'm repeating myself, but it's that important. Do not use cotton-tipped swabs. It's probably the single biggest thing you can do to avoid hurting your ears. So here's the final thought. Your ears are working for you 24/7, helping you hear the world. Are you giving them the care they need to stay healthy? The real takeaway here is to be proactive, not reactive. Don't wait for the pain. Think about these super simple steps to protect your ears. They're amazing, and a little bit of care goes a long, long way to keeping them healthy, so you can enjoy that next swim completely worry-free.